Good afternoon. I want to thank everyone for joining us today. Pretty quick update today. As we're approaching our 6th month of vaccine distribution, I think it's good to take pause of where we are. More than 66% of our eligible population in San Diego has received their first dose, and more than 50%, more than half of the eligible population in San Diego County is now fully vaccinated, and we are very encouraged by this news and by where we are. We're also mindful and very cognizant that we are at a place where we have more vaccines available than we have demand for them. This has been the case for a few weeks now, but our efforts around changing our mindset around distribution are certainly continuing and are accelerating as we work our way into the end of May and heading into the month of June. Our mobile sites have kicked off to a strong start. We've already completed 15 mobile vaccine events that got shots in the arm of more than 2,500 individuals. And so the ability to take a mobile site a little more convenient, a little bit closer to where folks are, we're beginning to see some positive results from that. And as a result of that, we're going to continue that. We're going to continue to expand that operation, continue to provide more opportunities, working with various entities, with businesses, with nonprofits, with religious institutions and others to go into the community to try and make it a little bit easier to give vaccines to San Diegans. We have mobile vaccination events currently scheduled through June 26 across San Diego County. I want to bring up the slide and show you just a few of the locations. You can get a full update of these on our website at coronavirussd.com/vaccine. Let's go back to the first one. Here again, you can just see spread throughout the county: Carlsbad, Chula Vista, El Cajon, Encinitas, Oceanside, Poway, City of San Diego, a mix of businesses, 12th and Imperial Transit Center in partnership with MTS, one of the largest areas, the Bahia Hotel, a farmer's market, a variety of things. We'll go to the next slide. Working with our community centers, with our religious institutions, our Muslim Community Center, the New Life Baptist Church, and many others. And again, these efforts will continue, and we encourage folks that are interested in having a mobile site to please go to our website and consider signing up for those. In addition to what we're doing around mobile sites, we're launching a variety in the coming weeks of individually targeted programs and efforts designed to engage populations that may not be as motivated to get a vaccine, to try and spark interest in a unique way. Next week, we are launching Our Health is Worth a Shot Challenge. This will be launched on Monday, May 24th. It will run through June 14th. It is a visual and video art contest that challenges San Diego County youth to raise awareness about the importance of COVID-19 vaccine. Youth and young adults aged 12 to 24 are eligible to participate. The idea for this creative contest came from conversations our team has had with youth groups throughout San Diego County in terms of getting ideas and suggestions for what they are. The challenge offers 3 categories for submission: Real Talk, creating a 15 to 60 second video responding to a question prompt; Vax Facts, create or design a visual art piece highlighting at least one fact about COVID-19 vaccines; and Beyond the Shot, create a 15 to 60 second video or visual that showcases a positive impact made possible because of the vaccines. We're encouraging submission from youth and adults who come from all walks of life and culture, and encouraging submissions in multiple different languages. The winners will receive gift cards sponsored by the San Diego County Credit Union, and the top prize is $1,200. Winning submissions will also be featured on our social media campaign. Details about this challenge can be found at coronavirus-sd.com/challenge. This is one of what will be multiple unique campaigns that we are working on that we will be rolling out in the coming weeks, again with an effort and an eye towards engaging a variety of populations. We're excited about the youth contest, and again, this idea came out of conversations with youth of a way to spur engagement and interest around this. But all of the efforts that we're doing around social media advertising, digital advertising, online advertising, all of those continue, as does our continued engagement and work with community-based organizations to continue to promote and work through questions, concerns, creating engagement, and what we're doing to actually get the vaccine into communities to make it easier and more accessible. We know it's going to be a little bit of a grind as we climb from where we are now with 66% of our eligible population having received their first dose. We want those numbers to continue to climb. It won't be as rapid as it was in the early days, and it was no longer predicated on the supply of vaccine. Now it's really predicated on our ability to get out and work with folks and make those shots available. So look ahead in the coming weeks to additional information, additional programs, additional targeted efforts that we're going to be launching as we continue to work through this. Let's jump into our regular charts, and then we will hear from Vice Chair Vargas. Again, not as important a weekly chart anymore, but we still want to share it with you, the supply of vaccines coming into the region. We have plenty of vaccines. We are certainly able to meet the need, even with the opening between 12 and 16-year-olds. We have been able to meet that need. I know my 12-year-old got his first dose. He was very excited about it, and it was not hard to find an appointment for him. Next slide. Here again, just our case counts. You know, our numbers just a couple days ago, they're at 47 was a low. You had to go back to the early days of the pandemic to see a day that low. Obviously, there's some day-to-day fluctuations. That's always been the case throughout. But our rolling percentage of positive at 1.4% there, again, we continue to do very well. Testing remains available, and people continue to utilize the testing. But our numbers, again, are very steady and holding steady as we see the increase in people doing more things. Next slide. And here again, it's just our chart. Again, you see our case rate descending. We're creeping on down. Numbers are all headed in the right direction. But again, still in that orange tier. And almost certainly for San Diego, it's going to be awaiting June 15th as the date we get to of the retiring the blueprint, the tiers, and moving forward. It is, again, highly unlikely we see any change in our tiering between now and then. But we do look ahead to that date just a few weeks away. With that, let me invite up Vice Chair Vargas, and then we will get to your questions, and both Dr. Wooten and Shaw are here as well for any questions that may arise.
Thank you, Chair Fletcher. It is very encouraging to see, actually, that our parents are taking their children to get vaccinating at our county locations. According to our county health officer, young people 18 and under are having an increase in the percentage, of the cases. The rate has gone on from 3% to 22%, and so that is why it's so important for our young people to also get vaccinated and get help to reduce the risk of infection and spread as we get close to our targeted goal. We are at 67% in terms of full vaccination for our goal population, and if we want to reach our goal by the set date of June 15 for the California reopening, we need to continue to work together to vaccinate our community, and we've been steadily gaining ground, and I would like to update, I just really excited about that, and we're going to be doing a lot of work with the county, as a county, to make sure that we're partnering up and coordinating with our communities, with our organizations and schools, to make sure that we are reaching the folks that have not been able to get vaccinated just yet. So I do want to continue to emphasize that it's really important to get vaccinated. We have, like Chair Fletcher mentioned, 27 mobile units for people's convenience, and we're going to continue to advocate and ensure that people have access to them. Estamos muy contentos que los padres de familia están llevando a sus hijos a vacunarse en nuestros centros de vacunación del condado. De acuerdo con la Oficina del Oficial de Salud del Condado, hemos visto un incremento en los casos de personas menores de 18 años. Por lo tanto, las estadísticas nos demuestran que la tasa de infección en este grupo ha incrementado del 3% al 22%. Es por eso que es muy importante que los jóvenes menores de 18 años se vayan a vacunar y si así pueden ayudar a reducir el riesgo de infección. Hemos llegado muy lejos ya desde que iniciamos nuestra primera campaña. Estamos ya al 67% de vacunación en cuanto a nuestra población, el objetivo que teníamos. Y queda claro que si queremos llegar a nuestra meta antes del 15 de junio, es importantísimo que cuando el Estado de California abra la economía completa, necesitamos trabajar juntos para proteger a nuestra comunidad. Estamos ganando terreno poco a poco y vamos a seguir abogando por las comunidades. El condado está más que listo para colaborar y seguir colaborando con nuestras organizaciones, con las escuelas y en la comunidad para asegurarnos que vamos a llevar las vacunas a los que más lo necesitan. Un programa del cual vamos a estar trabajando en la siguiente semana va a ser un programa enfocándose en un concurso para los jóvenes. Este programa va a estar enfocado para los jóvenes, puede mandar un video de 60 segundos. Uno de ellos puede ser qué importancia ha tenido las vacunas en su comunidad. Otro video de 30 segundos, 60 segundos, pues para ver cómo la vacuna los han impactado. Y también la oportunidad de crear alguna pieza de arte en donde puedan identificar cómo la vacuna ha impactado a sus comunidades. El premio va a ser de $1,200. Es un proyecto que tenemos con uno de los bancos sobre crédito aquí en San Diego. La información la vamos a desenvolver en los medios sociales, en las páginas sociales. Entonces, la única manera que vamos a poder llegar a nuestra meta a 75% para que la gente podamos llegar a seguir nuestras vidas cotidianas es pidiéndoles a todos que se vacunen. Así que cualquier información que necesiten en la página web del condado puede llegar a tener más información y estamos aquí para servirles y ayudarles. Gracias.
Thank you, Vice Chair Vargas. We'll now go into our call-in questions.
The first question will be from Allison Ash with NBC7.
Hi there. So at least one California county is now requiring businesses to ask their employees if they've been vaccinated. Have you guys talked about doing that in San Diego County, and why or why not would you consider that?
Well, we continue to urge all San Diegans to get vaccinated, and we continue to do everything we possibly can, not only to make the vaccine available, but to engage in meaningful conversations with San Diegans who may have concerns or questions or hesitancy. And we think that is the most appropriate response and the best way to move forward in terms of getting to the place we want to get to, which is the greatest protection for the greatest number. And so we're going to continue on that trajectory and path.
So no plans to ask employers to take a head count of who's vaccinated and who's not?
No.
Just to be clear.
Yeah, no.
Okay, thank you.
Thank you, Allison.
This next question is from Jeff McAdams with Fox 5.
Hi there. Two questions, if I may. The first one, just when it comes to mask mandates moving forward, especially with kids 12 and under, obviously they have not had the opportunity to get the vaccine yet. What are we looking at in terms of masks currently for them, in terms of mandates, and after June 15th? Because a large portion of those kids, I assume, will still not be vaccinated as of that moment.
Will Dr. Wooten address that?
Thank you for that question. Currently, we are still following the guidelines that we've been pretty much following since last year, and that is 2 years of age and older. Children 2 and older are recommended to wear masks, and that's based on our guidance from the state, the California Department of Public Health Services, and that's a CDC guidance as well. So we are currently maintaining that guidance. Once June 15th reaches, I don't anticipate that will change, but we will still operate by the guidance from CDPH, and their guidance will be updated and modified after June 15th for beyond the blueprint. Thanks.
Thank you. Yeah, and the other question, I don't know whether this is more of a state level or a county level, but I know in other states we've heard about businesses choosing or having the option potentially to refuse business to people who have not been vaccinated. Has that been anything that's been discussed on a county level, and will that be an option for businesses to decide to do on their own?
I believe that may be an option for businesses, but you really have to talk to them. There's been no county effort involved in those discussions.
Okay, thank you.
Thanks, Jeff.
This next question is from Jonathan Mosen with the San Diego Union Tribune.
Thank you. I have two vaccine-related questions. The first has to do with the progress that we've made so far. I know the numbers keep going up, but it does seem like things have slowed down a bit. I think Supervisor Fletcher, you acknowledged that. We have these goals on the vaccine dashboard for certain numbers we're trying to reach. I think the county said we want to get there by July. What if we don't reach those numbers? Or what if we do? What if we do or don't by July? What then? Or is it really just going to be about, no matter what happens and what timeline, continuing that gradual work of vaccinating more and more San Diegans? That's kind of my first question. Second question is if we're seeing evidence that the virus is spreading more among populations that haven't been vaccinated as much to date. I think Supervisor Vargas said that cases among 18 and under had gone from 3 to 22%. It wasn't clear if that was new cases or if you could say a little bit more about that, but just wondering if the less vaccinated populations are now visibly accounting for more and more cases in the county.
Got it. So, Jonathan, I'll take your first question, and then we'll have one of our doctors come up and address the second question of, is there any quantifiable evidence that the spread is happening with folks who are unvaccinated? I don't know if we'd have it broken down that way or not, but we'll give them a minute to get ready for that. On your first goal, look, there's no doubt the pace at which people are getting vaccinated has slowed. That is not surprising, though. You had a large section of the population that was very, very motivated and very eager to get vaccinated, and we all lived through the first few months of not enough appointments immediately available to meet that need. And now we're in the second phase where there's still individuals out there, and we see it every day. People are still getting vaccinated. We see it. More than 2,500 folks have shown up to our mobile sites. There's folks out there that are willing to get vaccinated. But we gotta take it to them. We have to do it in a little bit more convenient way. We gotta try and incentivize and engage folks who want to get vaccinated. And then there's going to be a certain population of San Diegans that are just not going to get it. But we want to get that number as high as we can. The goal that we outlined is an aspirational goal. We like to have goals. We like to have things we drive towards. We like to have things that motivate us to continue to move. But there's nothing in our progress towards achieving that goal that is at this point going to have any impact on what happens on June 15th per the state of California. So we're going to continue to strive to hit that goal. I think we will at some point, get there. But it is more an organizing tool around giving us something to strive towards and continue for us every single day to keep the pressure on ourselves to make sure we're thinking about new and creative and innovative ways to engage with folks and to not just passively make the vaccine available, but really, in an engaged way, get out and try and meet the need for communities that may be a little bit harder to reach. So it won't have any impact on June 15th, moving beyond the blueprint or any of those types of things. But we do think it is important, and we do want every San Diegan to get vaccinated because we know the potential life-saving potential that comes from people getting vaccinated. We know the impact on lowering the probability of spread, the impact on lowering the impact on our healthcare system, and helping us work out of this and stay out of this and move beyond. And so we're very motivated to do everything we can to get as many people vaccinated as possible. And then we'll have Dr. Shaw address your second question.
Thank you.
Thank you, Jonathan, for that question. So we're tracking these cases related to vaccination status or not. So I reported about 2 weeks ago that we've had some post-vaccination infections, so you can assume that we're looking at those cases, including hospitalizations and deaths. But we've had 357 post-vaccination infections, and none of them have been hospitalized, and there have been no deaths associated. So hopefully that answers your question.
Yeah, I think I just remember Supervisor Vargas sounded like she had mentioned that the cases among younger people had kind of jumped from this fraction of 3 to 22%. I wasn't quite sure if that was just among new cases, and maybe that speaks to the fact that young people are less likely to have been vaccinated. Just make sure I was getting that correctly.
Right, and I don't have those exact numbers, so I'm happy to answer that next time. So.
Okay, thank you very much.
And Jonathan, a part of that could be just attributed to kids going back to school, being tested more. There could be a number of factors that help contribute to that. Thank you. Next call-in question.
This call is from Paul Sisson with the San Diego Union Tribune.
Thanks so much for taking all of our questions today. I had a question about outbreaks. As we saw in yesterday's report to the Board of Supervisors, San Diego is on pace in May to have fewer outbreaks than occurred in April, and it's way less than occurred at the peak in December and January. But yet they are still occurring. I wonder if somebody in public health might talk a little bit about some of the commonalities that you're seeing across outbreaks that have occurred. I'm thinking, also of the Rock Church, and they're talking about a multi-site outbreak that they've experienced. What are some of the activities in the places where you're seeing outbreaks? What are the commonalities in recent outbreaks compared to those that might have occurred previously?
Thank you, Paul. On Tuesday, we reviewed with you all of the outbreaks, and particularly those outbreaks that have occurred in the various settings. And that has not changed. If you look at the various settings, businesses, also restaurants and bars would be second, grocery stores, and then preschool is number 4, and then that's followed by the healthcare system. And yes, we've had outbreaks in some churches, most recently the Rock, but that's the information that we have, and we share that on a weekly basis, the various settings where our outbreaks are occurring. They are decreasing, and so that's the good news. And hopefully soon we'll be back to the actual threshold metric of no more than 7 outbreaks in 7 days. But those are the various settings that we are seeing outbreaks in.
Dr. Beaton, a follow-up question on that, if I may. Obviously, it's a different world now with a lot of people being vaccinated. As you guys look at what's occurring in these places that do still have outbreaks, are you seeing an erosion of certain protective behaviors? What are you finding out in terms of investigating these outbreaks, and what kind of behavior is going on when they do occur?
Paul, there's no magic answer here. The same thing that caused outbreaks last May causes outbreaks this May. It is someone who is infected, either with or without symptoms, and they expose others. And the way to prevent that exposure is for people to wear their facial coverings, watch their distance, and wash their hands. There's nothing that's changed here. We are seeing a decline overall in all of the outbreaks, but the way that this virus is transmitted has not changed.
I wonder if you feel if people are getting maybe a little careless now that we have so many people who are fully vaccinated.
Well, actually, because we have so many people fully vaccinated, we have seen the outbreaks decline. Going back to December, 1,645. Push forward to March, we had 76 outbreaks, resulting in 358 cases. And in April, 85 outbreaks, 432 cases. And now in May, it's not fully ended yet, but so far we've had 28 outbreaks, reflecting 105 cases. So the outbreaks are declining. They haven't gone away, but they are declining if we compare us to November, December, and January, and even February of this year. Thank you.
Thank you.
We'll now go to our text-in questions.
The first text question is a follow-up question from Jeff McAdam, who was on the phone earlier. He wants to clarify, does the county have to follow the state's decision to mandate masks until June 15th, or could it have chosen to go with the CDC suggestion that vaccinated people can lose the masks in most situations? And why do you feel so many states are split on this decision?
Well, the county is going to follow the California Department of Public Health recommendation. CDC made a recommendation, but they made clear it was up to state and local jurisdictions to determine what they wanted to do. And, Jeff, it was just a few weeks ago that vaccines became widely available in terms of being able to easily access them in the appointment system. We have a lot of folks just getting in now to get their first shot and to get their second shot. That's why the date of June 15th, I think, was selected, because that was the point at which we feel everyone will have had access to get their first and second dose to provide the full protection. And so I think it's an appropriate step. It's just a couple weeks away, and it is a very modest thing. We certainly I heard from a lot of businesses who said their workers were not comfortable at this point moving so rapidly when so many people had still not been able to get the vaccine. The other thing is we've effectively killed the notion of a vaccine passport, so there's no real way to tell who's vaccinated and who's not vaccinated. And so just taking a couple weeks to let us make sure everyone has the opportunity to get the vaccine, looking ahead towards the lifting of that June 15th right around the corner, I think is a prudent and wise move. We've done very well in San Diego County with death rates and case rates and hospitalization rates significantly lower, certainly than states that took a different approach. And I think we can see that through for a couple more weeks.
The second question is from Mike McKinnon with KUSI. Why should San Diegans and San Diego County follow the state on mask guidance over the CDC?
Well, the vast majority of San Diegans have trusted both our local and our state public health experts, our doctors. And I believe they have guided us very well through this pandemic, through the challenges we've faced. I think the results for San Diego County and much lower case rates, lower death rates, certainly than states that took a different approach, give us the reason to have that trust in their guidance for just a few more weeks. And I know we all eagerly look ahead to June 15th with the moving beyond the blueprint and the retiring of the tiers and the lifting of the mask requirements. But it's just a couple weeks away, and I think we need to trust our healthcare and medical experts and doctors to guide us through the final stretch here.
The final text question is from Kelly with Fox 5 News. We've seen and heard about some businesses, specifically grocery stores in San Diego, not requiring masks anymore for shoppers. Are masks up to discretion of businesses, or are they required to follow the state guidelines when it comes to wearing masks inside stores?
Yeah, we are exactly where we were a few weeks ago. The mask requirement has been in place for quite some time. It's still in place for a couple more weeks. And so the expectation is that everyone will follow those requirements in San Diego County. And again, it's just for a few more weeks. That concludes our questions for today. I want to note next week our board will be in budget deliberations every day next week, and so we do not have a planned media briefing. If something breaking or imperative happens and we need to, then we will schedule one. We will continue to make all of the information available to you next week, and we look forward to joining you the first week of June to give an update on where we're going, but also to begin to talk about the post-June 15th transition plans as we move ahead. So thank you, everyone, for joining us today, and we will see you in 2 weeks.